Hi, I'm Howard Wetsman, Chief Medical Officer of Townsend. I'd like to talk to you today about the idea of relapse. Society uses the word relapse in addiction to mean the use of reward after a period of abstaining. But that only makes sense if addiction's a behavior and not a brain illness. As with any illness, relapse in addiction is actually the resumption of symptoms after a period of successful symptom suppression. Most of the time, relapse of addiction starts before the first use of a chemical or behavior, so it's important to watch for illness relapse in order to prevent using. That means we have to know the symptoms of addiction and what to look for. Townsend has created a list of 10 symptoms, 7 symptoms of low dopamine and 3 symptoms of high dopamine. The low dopamine symptoms are poor focus, poor motivation, poor memory, lack of ability to attach or care, and lack of ability to enjoy. The high dopamine symptoms are tics or stutter, OCD-like symptoms, and general fear of the world around us. Symptoms can come back for a variety of reasons. Low dopamine symptoms can come back when there's lowered dopamine tone. Dopamine tone can go down with decreased receptors, decreased dopamine release, or decreased time for the dopamine to act on the receptor. Decreasing 12-step recovery can decrease dopamine receptors, and others can change with health status or medication changes. High dopamine symptoms can come back with an increase in dopamine tone. This can occur with changes in health status, including pregnancy, or with a change in medication. Anytime there is a change in your medication or health status, your addiction doctor should know about it, even if you think it's unrelated. When symptoms return, we may not notice right away. Sometimes it's a gradual process, and sometimes it's sudden and jarring. Sometimes we're the last to see it. That's why it's important to be surrounded by sober people familiar with the illness who can be a mirror for us. There's another caution about noticing symptoms returning. Sometimes we don't let them because we pick up another reward that we don't think of as a drug. So the people around us that are our trusted mirror can't just be looking for alcohol or pot or gambling. They need to know what we know about the illness and help us watch the whole thing. It may be obvious that symptoms have returned for a particular reason, such as a medication change or pregnancy. But even if we think it's obvious, the best thing to do is talk to our addiction doctor or their assistant about the situation. The thing to avoid at all costs is making changes in our medication ourselves. It also may not be obvious why symptoms come back. It would be convenient if we had a little red light that would come on when our dopamine receptor density decreased, but we don't. An important part of dealing with symptom relapse is to work the appropriate steps with our sponsor to ensure maximum dopamine receptor density.